Welcome back to another episode of the Benefits Insider. I'm your host, Chris Hamilton, and today I want to talk to you about how to incentivize your employees to help lower your health insurance costs and get rewarded at the same time. In the last podcast episode, I shared the Wall Street Journal article that talked about conflicts of interest in health insurance companies that allow them to profit as your claims rise. And I shared what to do about it. And one of the things to do was to create a system that gave your employees access to lower cost healthcare options and reward and incentivize them to use those to help lower your claims costs, lower your insurance premiums, and lower their out-of-pocket costs at the same time. So today I want to share specifically what we should be doing as business owners, CFOs, and HR professionals within our benefits program to help incentivize the outcome that we want to see, which is better benefits, lower costs, happier employees. So let's dive right in. So in the last episode, we talked about how health insurance companies want to control the entire ecosystem. They own some of the, I call them subcontractors, many of the vendors that are contributing to the rising claims costs, which contributes to rising health insurance premiums. So when we look at the typical healthcare delivery system, what you see are these PPO networks and the claims that fall to those PPO networks. So the PPO network, the insurance, your traditional insurance carrier, that is the highest cost side of healthcare. So this, I've got it highlighted here, it's fully insured. It could also be if you're self-funded using a carrier and an ASO where they're managing all of the components of your health insurance program, your stop loss, your pharmacy benefit management, the network, all of those things. Whenever a carrier manages everything for you, they are sending you through the high cost side of healthcare. So what's the answer? What most of our clients are building today is what we would call an enhanced healthcare delivery system. And you hear me talk about healthcare a lot. Why? Because the cost of healthcare is what drives your cost of insurance. The higher your healthcare costs and claims rise, the higher the insurance premiums have to rise to pay for them. Think about this. Your brokers walked into your office at renewal and said, sorry, your healthcare claims are rising. Your insurance carrier's raising the premiums to help offset that. Makes total sense. Insurance premiums are just the symptom. Healthcare costs are the cause. So we want to make sure all of the clients that we work with, they want to make sure that they're providing the best-in-class benefits to their employees, but they want to do it in a sustainable manner financially. They don't want to exclude benefits. They don't want to prevent employees from and their members from being able to access needed health care. But if there was a way, people have always asked me, is there a way to provide these things and ensuring that our employees are getting the best cost and making it easy for them to do so? So what we've designed is what I'm showing you here. We still use a PPO network most of the time, not all the time, but most of our clients want a benefit plan that looks very similar to what they already have today. So we start with one of the PPO networks. But in between, and this is really where the secret sauce is what do we do with claims before they are dropping to the highest cost side of healthcare, which is the PPO network? Well, we're building in outlets. I call them outlets, or I call them filters. And so the number one thing that we want to do, is the easiest thing you can do inside your health insurance plan to get a reduction in your claims costs and your premium, is to properly manage your pharmacy benefit management. We do not use the insurance carriers' PBMs because they inflate the costs because of the profit center. And as I shared in the last episode, it's a massive profit center for these insurance carriers. They want you using it. They'll talk about clinical integration and all these things. It's money. It's money for them. And it's a conflict of interest. You don't want the fox guarding the hen house. We get rid of them. And we use an independent pharmacy benefit manager, and we limit the way they can make money in a transparent manner. They're not taking spread. They're passing through rebates. You're getting the full net cost of the claims, which reduces your costs. And we've also got care programs. I've talked about this in other episodes too, that we can use that the traditional carrier-owned PBMs will not let us use. The second thing we want to do, and I'm going to dive into this in more detail, is care navigation. Most of the time when your employees need to go have a procedure done, call it a hip replacement or a back surgery or need to have an infusion, they don't necessarily know where's the right place, who's the best quality, and what does it cost. Most of the time, it's going to cost them their deductible. They don't really care about where they should go because it's going to cost the same no matter what. You have a plan that has a $3,000 deductible, or maybe it's $5,000 deductible. If I'm going to go get a $60,000 joint replacement or a $300,000 cancer treatment, do I really care what it's going to cost? Because it's going to cost the same no matter where I go. It's $3,000 or $5,000. Whatever my deductible and out of pocket, what incentive do I have? So the idea here is to do two things. One, help your employees find the best quality care, and then help them navigate financially their out-of-pocket costs, because for most of employees, the average employee, the financial burden of these medical conditions is extraordinary for them. And so I think there's a way, we know just based on our decade of experience doing this, that there's a way to help the employer manage insurance costs and help the employee get what they need and help their pocketbook at the same time. And that's using care navigation programs. I'm going to dive into that in more detail in just a second. But the other thing I want to highlight here on this third column is population optimization. We've got folks on our plans, you probably do inside of your company, that are on COBRA. Who takes COBRA? People that are undergoing expensive treatments. They're willing to pay the exorbitant cost of insurance privately for themselves because they know they're going to be high utilizers of the plan. They need it. Nothing wrong with needing the insurance, but oftentimes when we're offboarding an employee, there's education that can go into helping them make the best decision for themselves personally, and it also helps your company at the same time. The same is true for Medicare. You probably have folks on your plan that are Medicare eligible. They've never been explained Medicare, or they've never had somebody come alongside to help them. So we want to make sure that we're ensuring the right folks on our plan, and we're educating the folks that have other options on how to navigate the health insurance system. So how does the care navigation work? Well, I mentioned, and I'm going to give you an example of one of my clients, a recent report that I gave them. Well, this particular client uses the Aetna network. Aetna is who they use. And all of their employees have an ID card that has the Aetna network logo on it. So as far as any of them know, they have Aetna. Actually, this is exactly how I design our benefits here at Hotchkiss Insurance as well. I'm going to show you the way we do it too. So when members are enrolling in their health plan, they're enrolling in an Aetna network. All of them are PPO style plans. It's what they know, it's what they're used to, makes it simple. You get all the benefits that you've come to know and are used to over the last however long people have been buying insurance. If you had a copay, you've got a copay today. If you had an HSA, you've got an HSA today. It's exactly what you've got. But now what we're doing is we're layering on an additional benefit of care navigation, and you have some really big benefits here. The very first one is no out-of-pocket costs to get care. If you're willing to allow a clinician to schedule, coordinate your procedures or your medications, you can have those at no out-of-pocket cost. You might ask yourself, why would we waive somebody's costs for these expensive treatments? And the answer lies really in the savings potential. And I want to share a handful of examples here just to illustrate the kind of money that we're talking about. Now, these are examples from my own company. This hip replacement was me. What was interesting about this is I'd already selected a hip surgeon to do my procedure, and using our PPO agreement, you would see we would have paid $59,000, almost $60,000 for my episode of care. That's the facility, the surgeon, anesthesiology, radiology, everything all in. We had a direct contract with my surgeon and the facility, and I was able to get that procedure for less than $20,000. It saved our company call it $40,000. I have a $5,000 out of pocket. We're self-insured. So I'd ask you, if you're a business owner or CFO, would you waive an employee's $3,000 to $5,000 deductible to get a 8 to 10x return on that? And the answer for most people is yeah. We save money. Our employees are saving money. They're getting exactly what they need. That makes total sense. And you can see other everyday examples. Big cost driver for most companies, specialty medications. You can see there's very large savings that can be had by by managing the way employees are buying their drugs. What pharmacy are they getting it from? Who's distributing it? Colonoscopies, MRIs, these are all everyday things that your employees are buying. You can see there's very large savings here. Employees are winning in the process too because they're getting access to the care that they need, they're getting it at no out-of-pocket cost, and the company's claims are being reduced at the same time. So what could this look like for a mid-sized employer? I want to share a report that we generated for one of our clients. This group has about 100 employees on their plan, and this is the trailing, I think this is 9 months worth of data on their utilization of our care navigation programs. And what you'll see as I scroll through this, you're going to notice there's a lot of everyday procedures that are listed here. MRIs and colonoscopies, lots of colonoscopies and MRI, CT scans. You can see we've got stem cell treatments, more colonoscopies. Where's a big one here? You see a hip surgery that's been done. We've saved a bunch of money there. And really what you're looking at is this company has been able to save over the last 9 months compared to the insurance pricing, right? So this is typically what we're seeing, the PPO networks. This is going to be PPO pricing. This is if you use the network. This was the cost of the care navigation. This is the savings. In aggregate, over the last, June. This is a little over 6 months worth of savings. They've saved over $209,000. 100 Life company has saved over $209,000, and the employees received all of these services at no out-of-pocket cost. No copay, no deductible, no out-of-pocket. The additional step that this particular client has chosen to take is to further incentivize employees to use their program. And what you'll notice here, and I've redacted their name off of this report, is they pay a reward to their employees based on how much money they save the insurance plan, which is their company. So they're not only are they waiving the out-of-pocket costs for their members that need to get their care, they're paying them if they choose a reward that's based on the amount of money that the company saves in the process. So you'll notice here, members are getting $250 rewards, $1,000 rewards, $500 rewards, and the list goes on, right? So how do we calculate that? Well, we use this calculation of what would we have paid had this member used their network? What did we pay using the care navigation? How much did we save? And so if the plan saves under $2,500, the member gets $250. You can see the math and just kind of extrapolate that out. Over $5,000 generates a $1,000 reward back to the employees. So this is a way not only to benefit your P&L corporately, reducing your health insurance costs, it's also benefiting your employees. It's the way when I say putting more money to your bottom line and more money in your employee's paycheck, this is one of the core tenets of that. If you're looking for ways to reduce the cost of health insurance in your business and you're looking for ways to put more money back into your employee's pocket, this is one of the things you should start looking at because there's so much cost differential in the market for everything that people buy. And I think about it as like a gallon of gas. There's a gas station right over here outside of our office. There's two of them across the street from each other. If I walked out into the garage, drove out, and needed to get gas, and one of the gas stations had $8 a gallon gas, the other one had $3 a gallon gas, which one am I going to go to, right? Makes total sense. The gas is pretty similar in quality, I would imagine. And the same thing happens every single day when we're buying prescriptions. Same medication. Which pharmacy did we get it from? Under which contract did we use? Which MRI? Which facility? Which contract? Surgeons, you do get into a difference in quality, and what we oftentimes find based on the data, the higher cost surgeons, the higher cost facilities aren't the better quality. There's a bell curve, if you will, and you're going to find that typically the providers that are in that kind of the within that average, even slightly below, are typically going to have higher quality. Find those physicians and facilities, contract with them, incentivize your employees to use them. But remember, we go back to the two ways that members can access healthcare. If you want to use your network and you just say, I'm not going through a concierge program, I'm not going to go through care navigation, you have that choice. You've got Door A. You can walk through Door A all day long. It's the way you've always used your health insurance plan. But if you do want some help finding high quality providers and you do want to waive your out-of-pocket costs, you have the choice at the time you need care. So people always respond positively to what are we doing for you rather than what are we doing to you. And if you're like a lot of companies, it feels like when we're going through our renewal process, we're always doing something to the employees. We're raising their monthly costs out of their paycheck. We're raising their copays and deductibles. We're changing networks. Maybe we're removing out-of-network coverage, or we're narrowing the network. Those are things that are being done to employees often at a time that we're increasing their costs. This is an opportunity to actually do something to help them and lower their costs. And over time, you can lower the cost of health insurance for the business and for the employees. So I hope this was helpful. If you've got questions about this, I'm going to share a copy of the playbook or a link to the playbook that we use when consulting with our clients on how to add more profitability to your bottom line and more money to your employees' paychecks. And if you have questions about what this might actually look like for your business, feel free to shoot me a note. I'm happy to help any way that I can. But until next time, take care.